Hi, my name's Brittany. I'm from Polk State College, and this is going to be my comprehensive health assessment. My patient Chase is going to walk to the bed while I assess his mobility. While he was walking to the bed, I was assessing how well he was walking. He wasn't limping or anything. Can you tell me your name and date of birth?
Sure, my name is Chase, 17/1989.
Okay, and do you know where we are?
Yes, so I'm Winter Haven, Florida.
Okay, and who's our president?
Barack Obama.
And the year is?
It's 2015.
Okay. The patient's alert and oriented times 3. His speech is clear and articulate with no stuttering or slurring. Can you hear me just fine, or do I need to speak up?
No, I can hear you.
His hearing is also intact. His general appearance, his hygiene appears to be clean and normal for his ethnicity and culture. We're going to move on, I guess, to your assessment. I noticed that his skin it seems to be intact. I don't see any lesions or anything on the areas that are exposed. It's warm and dry. So I'm going to start on his head, his cranium. I'm going to palpate, make sure I don't feel any lumps or lesions or masses. I don't see any critters in there. His head is normocephalic. I'm going to have him look up at me. Can you raise your eyebrows? Okay. And squint your eyes really tight. And smile for me. Okay. All of his facial features are symmetrical. I'm going to palpate his frontal sinus. Any tenderness?
No.
And his maxillary sinus? Any tenderness?
No.
I'm also noting that his hair is evenly distributed and clean. I'm going to also palpate your lymph nodes, tell me if you have any tenderness. Nothing?
No.
Okay. I'm going to move on to your ears. I notice that they are symmetrical on his head. They are within their normal size. No redness. Skin is all intact on both sides. At this time, I would notice that he has no drainage or discharge from his ear canals. I'm going to, with an otoscope, I would pull back and up on his pinna and turn the otoscope upside down while visualizing his tympanic membrane. That would, if in normal limits, would be gray and pearlescent and translucent in color. And I would do the same thing with the other side. This ear is also intact, no redness, no drainage, or anything of that sort noted. I'm going to get close to you and I'm going to say 3 things in each ear and I want you to repeat them to me, okay?
A-B-4.
Okay.
C-B-6.
Okay, so he passes the whisper test. Next, I'm going to move on to his eyes. I noticed that the sclera is all white. I am going to pull down on his lower lid and inspect his conjunctiva. It is light pink moist, no drainage or redness noted. Okay, I'm going to shine this light at you and I want you to look directly into it. I'm going to shine this light. It is reflecting symmetrically on both corneas. Okay, I'm going to shine it in each eye. Pupils are equally reactive and round, first reaction to light. Okay, and we're going to do the 6 cardinal visions. Okay. Over your head. Okay. Follow my finger. Okay. So he passes that with an ophthalmoscope, which I do not have one, but if I did, I would get about 10 inches from his face with the light shining into his eye, looking at the back of his eye for the red light reflex. And I would progressively get closer until our foreheads were touching, and I would do that with both eyes, making sure there's no cloudiness or dark spots to assess grody cataracts. Next, I would move on to your nose. With the light, I'm going to look up into your mirrors. The mucosal membranes are pink, moist and intact. He does have slight septal deviation to the patient's right. Okay. Can you put your finger over your right nostril? There you go. And breathe in and out. No issues. Okay. And switch. Okay. Good. Okay. Both nares appear to be intact. Next, we're going to move on to your mouth and your throat. So I can see that his lips are intact and the pink in color. Can you open for me? His palate and his mucous membranes are pink, moist, and intact. And can you put your tongue to the top of your mouth for me? Okay. Keep it there. Okay. Underneath his tongue is also intact. And stick your tongue out for me. Alright. And I'm gonna look at your little membrane. Okay, and stick your tongue out and say off. Sorry. Uvula is midline. Tonsils are within normal limits at about a 1 in P. No lesions or discharge noted or sexual noted on the tonsils. Next, we're going to move to your neck. I already palpated your lymph nodes, so I'm going to start with your thyroid. Okay, can I have you swallow for me? Okay. The thyroid is not palpable and it's a normal finding. And then his trachea is also at the midline with no shifting. Can you turn your head that way for me? Okay, and look at this wall. Alright. And can you roll it around? Alright, range of motion appears to be intact. I'm going to assess your jugular pulse. Broader pulse. Okay. Now I'm going to auscultate. No bruise or jugular pulsations were audible. Okay, moving on to your chest. His chest is in a normal shape. It is not he's not barrel chested or anything of the sort. Just continue taking a couple of deep breaths for me. Okay. I'm just going to put my hands down here and I'm going to need you to take one big deep breath in and out. Okay. Chest rise is symmetrical. I'm going to start with the tactile firm test in the front and then put my hands across your chest, okay? So say 99.
99.
99.
99.
Again.
99. 99.
Okay. And I'm going to have you turn so I can get to your back. I'm going to have you take a deep breath again. Okay. Once again, chest rise is symmetrical. And 99.
99. 99. 99. 99. 99.
Okay. Make sure you don't have any separates. Okay. Now I'm going to go ahead and take a listen. Take deep breaths for me. Okay, and listen to your back. And last one. Okay. No adventitious lung sounds were heard. His lungs were clear bilaterally. Now I'm going to listen to his heart. Just breathe normal. One more time. No extra heart sounds were heard, no murmurs, no gallops, no clips, just S1 and S2 without S3 and S4 heard. Alright. Because he's a male, we're going to defer the self-breast exam. Moving on to the upper extremities. Okay, can you do me a favor and shrug your shoulders? Okay. And can you raise your arms up? Alright. Don't let me push him down. Okay, and now opposite, don't let me push him up. Okay, very good. All right, in range of motion. Okay, and your wrist. You turn in a circle. Good. Open and close your hand. Okay. Same thing on this hand. Okay. Open and close your hand. And rotate your wrist. Okay. Range of motion in all of his joints for your shoulders. Can you lift your arms out like that? Alright. And put them down and lift them up above your head. Okay, and down. He appears to have full range of motion in all of his joints. While he was moving his elbow range of motion, I was palpating to make sure there was no prejudice or anything felt in those elbow joints. Next, I'm going to go ahead and make sure he doesn't have any lesions or any tenderness within his arms. I'm noting that his hair distribution on his arms is even. He doesn't have any freckles, and his skin is normal color throughout. Next, I'm going to have you do what's called the balance test. I'm going to have you put your hands together like this. Okay. And usually I would have the patient hold this for 60 seconds. And after 60 seconds, normal finding would be that he does not have any numbness or tingling in his neck. So 60 seconds has passed. Any numbness or tingling in your fingers or hands? Okay, good. I'm going to do your deep tendon reflexes. Okay. All right. Palpate your radial pulses. Radial pulses are 2+ bilaterally and normal finding. Next, we're going to move on to your abdomen. Do you mind laying back and letting me touch your abdomen?
No.
Okay. I'm going to lift your shirt, okay? Alright. I'm noting that his abdomen is symmetrical. There are no hernias visible. And it also appears to be soft, no lesions or anything of that sort. I'm going to start by taking a listen. Listening for vascular sounds first. Listen to your left side. No pulsations are heard. He has present vowel sounds in all 4 quadrants. Next, I'm going to percuss your abdomen. Mostly it sounded timpani unless I'm over an organ. I'm going to palpate, telling you if you have any tenderness. Okay, you go a little further now. Some tenderness. Okay. His abdomen is soft and non-tender. I'm going to move now. Do you mind if I feel your femoral pulses in your joint?
No.
Okay. And you palpate his femoral pulses. Femoral pulses are 2+ bilateral. Some of them have any tenderness. Okay. No tenderness in the inguinal lymph nodes either. Okay, can I have you, actually I'm going to have you continue laying. I'm going to move on to your legs. Can you move this leg up for me?
Sure.
Okay, and down. And the other one. Good job. Okay, now I'm going to have you sweep this one out towards me. Good job, and back. And the other one out towards the left. Thank you, and back. Okay. And bend your knee up. That's good. And the other one. Very good. We'll do it one more time, okay? You feel your leg. Make sure your knees aren't coffee. Okay? Alright. Can you rotate one ankle at a time? Okay, and the other one. Very good. And curl your toes. Okay? Even though he has socks on, you can see him curling his toes. I'm going to palpate your pulses. popliteal pulses are reflex bilaterally. You mind if I remove your sock? I'll put them back. While I have his sock off, I'm noticing that his nails are pink and dry. His hair distribution is also even. There's a couple of little braids and everything. And his post-tibial and dorsalis pedal pulses are palpable. Next, I'm going to take your socks off again, sorry. And make sure you're listening. Okay. Negative releasing. Okay, and negative releasing the line. Okay, now I'm going to have you stand up if you don't mind. Okay. His shoulders are symmetrical from the front. I'm going to turn his face away from you if you don't mind. Shoulders are still symmetrical, hips are symmetrical. I'm going to have you bend over towards your toes. The spine is straight and at the midline, symmetrical, no curvature. Okay, and you can stand. Thank you. And turn around for me. Okay. And now I'm going to have you walk. You could walk 3 steps that way, or 5 steps that way. Okay. And now I'm going to have you return back to me, walking heel toe. Okay, very good. Rapid hand movements. I'm going to have you go index, middle, ring. You don't do it at the same time, but go down and back. Very good. Other hand. Okay, good job. Alright, now I'm going to have you put your hands out beside you and do finger to nose. Okay, other hand. Alright, good job. And now touch my finger into your nose. Okay, there you go, other hand. No, very good. Okay. I'm going to go back to your eyes now that I have you standing. I'm going to have you place this over your eye. Okay. Alright, and we're going to do, tell me when you can see my finger.
No. No. No.
Okay, and switch eyes for me. Tell me again.
No. No. No.
Okay, very good. Concentration senses. Moving forward, I'm going to have you close your eyes one more time. Okay, and open one of your hands for me. And place the object in there. Tell me what that is.
Feels like a key.
Okay, very good. Indeed, it is a key. And the other hand?
Feels like a paper clip.
Correct, it is indeed a paper cup. Okay, with your eyes still closed, open your palms. I'm going to draw a number on your palm, okay, and tell me what number it is.
Two. Good.
Good job. Okay. Now, open your eyes and have you drag your heel down your shin. Okay. Very good. And switch. Very good. Now with your feet together, close your eyes, and we're going to stand here for about 20 seconds. A small amount of swaying is normal, but he should be able to hold this position for 20 seconds. Okay, good job. Alright. I'm going to have you close your eyes one last time, and I want you to tell me when I'm touching you. I'll be touching you all over from head to toe, okay? So eyes closed.
No. 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 No.
Okay, very good. I'm gonna have you sit one more time. I'm gonna check your knee reflexes really quick. Sorry about that. Relax for me. Very good. This concludes my comprehensive health assessment.